Hello friends, my name is Rick from Numa Yoga. Today I'm going to show you how you can relieve SI joint pain and sciatic pain with a massage ball or a lacrosse ball or a tennis ball. So if you're curious about that, please join me laying long on someplace comfortable. I just like to lay on a blanket. You can use your yoga mat. You can just be on the carpet, but be in a place that's quiet and comfortable. Okay, so I'll join you laying long on the mat. So first things first, before any somatic practice, you want to take a moment to scan the body. So let yourself lay long. Let yourself relax, be loose. Take this moment to let go. Somatics are this opportunity for us to start to slow down and just observe. For that to happen, we have to let our body settle first. What we can do here is just start to observe your breathing. Taking in nice, long, slow breaths through your nose. And have an intention on your inhale to fill your abdomen like a balloon. So you inhale, you feel the belly expand, the waist expand, and even feel into the back. And then slowly, like a balloon, you're going to let the air stream out. And notice when you breathe in, like filling a balloon, it's evenly to all sides. So feel this abdominal area, waist and back, all expand evenly. Inhaling, feel the whole space expand. And exhale, slow stream of air out the nose. Feel the belly contract and sink inward. When you inhale, you feel this opening up, this expansion in the belly area. When you exhale, let the air slowly stream out like it's leaking out of a balloon. And the balloon evenly contracts inward. Breathing nice and slow, you're feeling your belly move and expand with your breath. If you notice your chest moving, you can even rest your hand on your chest. See if you can soften that. We want our primary area of breathing to be our abdomen, breathing low in our body. Chest is relaxed, throat's relaxed, jaw's relaxed. When we breathe low and slow, we start to shift our body into this relaxed state, this aware state. This is where we want our mind to be for somatic exercises, so that we can be more connected, be at ease, and then observe. We're trying to observe these tension patterns in our body, right? Few more nice, slow breaths, letting your body settle a little bit more into the floor with each exhale. Good. And then from here, we've tuned in and settled down a little bit. Just observe how your physical body feels right now. You might notice how your hips are resting into the floor, or your legs are laying on the floor. See if you can notice a difference between your right and left side. Maybe your heels feel a little different, or your feet could be different weight. They could be pulled at slightly different angles. Your knees might feel a little different. Just simply noticing. Notice if there's any low back pain there. If your back does hurt, please bring your knees up. But if you're feeling good, you can still have your legs long. We'll be bringing them up shortly. And scanning up the body, noticing the low back, how your mid back feels. Where are your ribs at? Can you notice what your ribs are doing as you breathe? Any tension across the chest or in the shoulders? Noticing if these arms feel similar coming out of your body, or is there an unevenness? One shoulder higher than the other, or feels heavier into the floor than the other. It's whatever you can notice, but just without fixing or changing anything, just being present to it, being curious about sensations that you feel. And then up into the neck, and even in your head. Can you notice, does your head feel in the center, or is it turned off to one side? And you can notice this too, let your head just turn right to left a little bit. See if you can find where that middle point of that knob in the back of your head is. Find the balance there. And once you feel centered, connected to your body, we can start to move into our practice. Now you're going to bend the knees, place the soles of the feet on the floor, find a relaxed place for your legs, and try to have them so the leg bones are coming naturally out of the body, not turned in or turned out, but finding that evenness, that center. Okay. From here, we're just going to make a few movements through our spine and notice how our spine is connected to our hips. Taking a few centering breaths, notice the length of your spine. And then be curious, how would you tap your tailbone down to the floor and allow your lumbar spine to make a bridge, as if you were going to slide something under your back. Keep your shoulders and the head on the floor, and you're going to arch your back. So let your belly come into the, float up off the mat, your ribs will open up, and your tailbone's tapping down. Feel this contraction on your back. Let your legs be relaxed. Slowly as you relax your spine here, easy does it coming down, down, down. Feel every muscle relax. We'll try this arch a few times. When you arch your back, it feels like your pelvis are rolling towards your heels and you're making a bridge. Try to increase the pressure that you feel towards your tailbone or the bottom of your sacrum, and it's making this tilt off the floor, this anterior tilt of the pelvis. And the magic is in here. When you relax slowly, the back muscles relax, and that melts down. So the hips are staying still here, and when you arch your back, the pelvis tilts. Hips gotta stay relaxed, so you might notice a little gripping in there. And when you melt down and out of this, what are the sensations that you feel? Notice if there's any skippiness or little jitters. Your objective here, your goal is to make this really smooth. Okay, so this is extension of our spine. We're just tuning into how our body's moving. Now, let's try the flexion of the spine. That's on an exhale, and you're gonna flatten that curve out, and you're gonna engage your belly and draw the tailbone up. So now you flattened out that lumbar curve by engaging your front body, and when you slowly let go of your abdomen, you're gonna feel how the pelvis tilts back down. Okay, and again, you want your legs nice and relaxed here, so you're training your core as you exhale to draw the tailbone up. Now our core muscles can get stuck in contractions that pull the pelvis forward and backward. So we want to educate these muscles first before we do anything else. A couple times, finding this flatten. It's an inhale, and then an exhale, the belly sinks down. And then you engage the abdominal wall, and you'll feel the sternum and the pubis draw closer together. You can even point your chin to the ceiling and let your tailbone scoop up. Feel this contraction on your front body. Avoid pressing through the feet and legs. And so slow, how slow can you let that go? Feel this lower half of you melt away from your upper half. Make space between the vertebrae in the lumbar spine. Good. We'll go forward and backward through this a few times and try to notice the pause in the middle or the neutral space. That's what we're looking for. When you arch your back, we're going into overextension, right? We're going into an anterior tilt, and we're seeing a really out of position spine. So feel that. Feel the curves in your awareness. Even tap the back of the head down, the chin down to the chest, the tailbone into the floor, making this long bridge. Take 10 to 15 seconds here, just so slow. So slow, let that melt away. Let all the tension that you feel, all the contractions you feel, dissolve. Everything melts away. Back to neutral. This is your parasympathetic rest and digest spine, nice and at ease. And then you flex the spine. So you exhale, you engage the belly, the lumbar spine flattens out, chin goes to the ceiling. Now you're in that shutdown response. You're pulling your body into a fetal position. This is where our fear lives. Real slow, real slow. Let that go. Let it go. So not only are you letting go of a contraction, you're letting go of an emotional response. Same thing when you go back into the arch. When you arch your back, you press the back of the head, you tap the chin, you might feel some of that energy to go forward. This is your fight or flight mechanism. When we are triggered and we engage the fight or flight, our back line activates. And then nice and slow, you let that go. So you witness that contraction, relax. Come back to your natural, neutral spine, right? Arrest and digest. Exhale, flatten. So back and forth, you're seeing these two out of shape positions that we get stuck in, right? You're learning to let it go. Come back to your calm center, and then into the arch of the other direction. Good. Let's make this more of a full body thing. So if you got that spine going nicely, the next time you go into the arch, press your shoulders back and let your knees open. So now the hips are starting to rotate. When you exhale, back to neutral, pause in neutral, and then an exhale, you're gonna flatten the belly, point the chin to the ceiling, reach the shoulders to the ceiling, the arms being noodles, knees pressing together. So now your whole front body is closing up. You're gonna let that relax, neutral, and then arch your back, open your knees, tap your chin to the chest, press your shoulders into the floor, and then relax. So back and forth. And if you've been pausing, etc., it's feeling good, you can start to move through this a little bit more smoothly. Letting yourself pass back and forth as you arch the knees open, the shoulders press back. As you flatten, the shoulders float up, the knees tap in together. Good. Just a few times, back and forth, nice and slow, observing your whole body here. Paying attention to your movement, noticing where it feels sticky or bumpy or jittery, and starting to clean this up. You're using your awareness to start to recruit all the muscle fibers, all the cells to work as a unit, as one piece. This cleans up everything that you do, all your movement. All your movement becomes more efficient. Less effort, more ease. Good. Okay. So you can let that come to a pause. When you feel complete, take a breath. Notice how you feel in your body in stillness. What does the echo of that practice feel like? What do you notice in your breathing, in the feelings of the physical body, or even in your mind? Noticing the thoughts that are bubbling up or any emotions that bubbled up. And seeing if you can let those go. Become back to being present. Okay. So from here, what we're going to do is we're going to grab that ball. And now we're going to pick a side. So I'm going to pick my right side to start out with. And what you're going to do is you're just going to let that left leg lay long. And you're going to take the tune-up ball and you're going to place it on the top half of the glute muscle. This is where your glute medius is. And we're going to start to work this all around where the hip bone comes into the pelvis in the back, and we're going to work around into the glute. So move this around in this area as we move through this practice. And you can just be your own explorer with what feels good. But the motion's going to be like this. I'm going to place this right in here, just on top of where my hip is coming into the pelvis. This knee's going to be pointed up. I'm going to relax my arms at the side. And just notice where this ball is right here. And can you contract into it? So you're going to engage the glute of the right leg. And then you're going to relax the glute over it as you let your knee open up. And then you're going to slide over. So letting the knee open, and then you're going to come back up. So you slide over, put some pressure into that, and then slowly bring the knee back up. You're going to open the knee a little bit, and then you can engage into the glute. Then relax, let the knee open up a little bit more and feel that sinking in. You can even try this with the knee pointed out. You could just engage right here. See if you can squeeze that glute muscle on top of the ball. Notice that contraction. And then real slow, can you let that go? Might feel really bouncy, really jittery. And then when you let that relax, you can slide a little more weight into the ball by leaning to the right and then leaning to the left. Bring that knee back up. Move the ball as you need to, just to kind of work around this whole space. And as you open the knee, then you can contract. Really focus on squeezing that glute. How well can you activate this muscle? And then nice and slow, as you try to let it go, you'll notice how bumpy this is, how hard it is to control a glute muscle. Now within here, within your glute, as you're working through this, there's all these deep rotator muscles known as the deep six. And all of these muscles, any one of them can get tight and start to pull our hip into this rotation, this external rotation. Now, particularly the piriformis back here is the main culprit in causing SI pain. So if we can get these external rotators to start to soften and relax, then there's more room for that nerve to flow down the leg. And there's that inflammation that's triggering the pain can come to some ease. So just explore around in here as you open the leg, engage the glutes, and then melt over the top. You can slide around in here. Let this ball work around the hip. Deep into your glute. A few more times. Making sure that you got the knee coming up and down. And the rest of your body, friends, is relaxed. It's at ease. You're just focusing right into where the leg bone is coming into the pelvis, and you're engaging the glute, softening, lifting the leg up and down. So really stir in this area up, massage in here. Another minute. Focused work. Really slow contractions, slow releases. Melt over the ball. See if you can soften, soften, soften. Notice deep into this space. We bury lots of attention, lots of emotion in our hips. We start to lock down and batten down in here. This makes walking more of a challenge, makes standing a challenge, makes our movement painful. So when you start to clean this up and soften this area, movement, you'll notice walking after this will be a lot easier. Good. Okay. The next time you bring your knee up, you're going to remove that ball, and then check this out. Slide your leg long. And notice your right glute compared to your left, or if you did the left side first, your left compared to your right. And this side will feel, at least it does in my body, far more relaxed into the floor. You could even try this. So we call this winking and blinking. So imagine your glutes here, right? Like they're your eyes. How would you blink your eyes? By engaging both glutes. So you're squeezing both glutes, and now slowly relax both of them and see if it feels any different right side to left. Maybe the right side's easier to do. Try that another time. Squeeze the glutes, slowly let go. That's blinking. And then you can try winking if that feels good. So you can engage the right one. Notice how that lifts the right hip up a little bit. And let that go. And then try the left one. And let that go. See if this is nice and smooth. Now, it might want to splash out or drop out at the bottom. It's challenging. These glute muscles are deep, they're big, they're powerful external or extenders of the femur, but also external rotators of the thigh. Good. Play with that side to side a little bit. You could try winking again, engaging both and relaxing. But you're taking some time here to pay attention to your glute muscles, which maybe you've never done before. And it's really interesting to do because it is a hard muscle to control somatically. That means with our awareness. Okay. When you're ready, take that ball, bring the left knee up, place that anywhere around here in the glute muscle. We've already explored around over here, so you know what you're doing. So when you're here now, you can let that left leg open up and engage the glute muscle. And try to relax and soften over that. Massage or rock around. And then bring the knee back up. Now when you bring your knee up, think about that coming from your hip socket. Think about when you move your femur, all that movement comes from your deeper core. Your femur, it doesn't move from your quadriceps or your hamstrings. Try to move that from deeper within. It might seem more challenging or just even like, what? But can you move your femur from inside your hip socket? Can you focus on doing that? Train yourself to rethink about movement, to rethink about how you move. Everything should be coming from this area first, your deep core. The area of your pelvis, your low back. Really focus on your movement in here. And when you do, everything seems to get easier. Walking, hiking, jumping, jiu-jitsu, whatever you like to do, climbing, it all becomes more simple because you're more aware of how you use your body efficiently and effectively. That's what's so magical about somatics. It's like the microscope to your movement. And if you get obsessed with it like me, then you start to really learn the finite parts of movement. And it becomes a fun exploration. Okay. Just keep moving that around, playing with rocking side to side and engaging your glute. Experience your body. Be curious about your body. Well, it's a playground. A few more times, side to side. Good. Making sure to contract into that, feel the muscles engage into the ball, and then notice when you try to relax over that ball, it might feel really jumpy, really difficult to control. If there's a lot of tension in here and it's kind of ouchy, it hurts a little bit, make sure not to overdo it, right? If we strain our body too much, then what we're trying to do is not going to happen, which is to get muscles to relax. If we overstretch or we overforce anything, then it's actually going to cause a fear response in our nervous system, and it's going to tighten those muscles down. We want a relaxation response. We're teaching our nervous system to relax our muscles. All right, this is different than stretching. Good. We're learning to let muscles be supple and long. It is the only way to get muscles to let go. We can't stretch out tension. Tension's a learned thing. Okay, good. So now you can come off that ball and you can let that leg go long. And notice each side. You might both feel really relaxed. See if you can even breathe down into your hips. Notice your breath going low, deep into your body. We want to be low breathers, right? Not just belly breathers. You want to be breathing all 360 degrees. So as you breathe, feel your back, feel your hips, feel your belly, that balloon inside, right? Exhale. Now from here, let's bring our awareness back to the thighs, the hips. And can you roll both legs inward? And then roll both legs outward. So imagine your legs are rolling pins here. And you roll them in and you feel the hips roll in. Now real slow. Try to control from right here. Roll them open. This may be really challenging. Roll your toes like you're bringing your pinky toes to the floor, and now engage your glutes and try to roll open just a little bit more. And then relax your glutes. Roll these hip bones inward, roll them in, roll them in, roll them in. When your big toes are pointing towards each other, exhale, engage the belly, and then let go of that, and then let the hips roll open, roll open, roll open. When the pinky toes are opening, engage the glutes, press the shoulders back, feel your back body active on that external rotation. Relax. Roll the big toes together, flatten the belly, point the chin into the air. You can even slide your legs a little bit in and bring your knees towards each other. And then let that go a few times back and forth. When you roll the legs open, you engage the glutes, you press the shoulders back, you feel your back line active. When you roll the legs inward, you bring the shoulders up, you engage the belly, you point the chin up, back and forth. Feel through your body, notice all your movement, especially through your joints, hips, through the spine, and shoulders. Let your arms and legs just be kind of passive observers. They're not doing anything. It's all coming from your core. The thighs are relaxed, your hamstrings, your upper arms. It's just the spine moving, and you're feeling these joints at the top and bottom of the torso, kind of curling in and then pressing back. Nothing more than that. Good. And as you tune into this, as you're moving through this, start to make it very, very subtle. Starting to shift this movement into almost an imperceptible movement. On another layer, experience your movement drift into the subtlest of the subtle. If someone was to perceive you, they wouldn't even notice your body moving, but you feel it internally. You still feel those muscles engaging. And notice when you slowly let that go at this minute level, you might feel even more opening up or more connection to these invisible layers of tension within you, and consciously you're softening them. A few more times. Let this movement just drift you deeper into your body, deeper into your awareness, deeper into a state of ease. Maybe you're noticing just one small space in your body. Maybe that's in the low back, in the low abdomen, deep in your hips. Smallest contractions. Letting go. And then pausing in stillness. Breath is light and at ease, barely breathing through the nose. Belly barely moves with the breath. Let the feet be relaxed, the hands, the arms, the legs, upper legs, upper arms, hips, shoulders, all relaxed, at ease. Belly, back, chest, heart, lungs, softening. Heads relaxed, neck, jaw, throat, eyes, ears. Everything's at total ease. Every exhale softens you a little bit more. Every inhale is a bit of expansion and growth, nourishment. Every exhale is a letting go. Allow yourself to be in this space for as long as you'd like. Thank you for practicing with me today, friends. Namaste.